Now, principles of bandaging means what rules we should follow while applying roller bandage. We should make sure that the person is comfortable and tell him what you are going to do. Work from the side of the injury so that you do not have to lean across the body. For example, if you are applying a bandage on left hand, you should stay on left side of the client. Keep the injured part or body supported in the position it will be in when the bandage is on. Okay, so for example, if you are going to keep the hand like in this position after the bandaging, so even before bandaging you should keep the body in this position so that bandage can be applied properly. Use right size of bandage. Different parts of body need different width of the bandage. Avoid covering of finger or toe tips when bandaging a limb so that you can easily check the circulation. You should leave the tips so that you can check whether it is pink or bluish. The bandage should proceed from below to upward on the limb. For example, you are applying the bandage here, it should start from lower part and then go upwards. Okay. While bandaging, cover 2/3 of the previous turn and proceed 1/3 upwards. Okay, when you are applying bandage, you should go upward 1/3 of the width of bandage and cover the previous 2/3. We should keep the turn parallel to each other. Okay, so the turn should be parallel to each other. The bandage should neither be too loose or too tight. We should keep in mind. While bandaging, we should never apply knot or pin over the wound. For example, if the wound is here, we should not apply the knot here. We should apply the knot outside. And if the wound is outside, then you can apply the knot here. While removing bandages, first loosen the end and pass the bandage from one hand to another and gathering the loose bandage in the hand. Okay, you should keep the loose bandage in your hand. You should not throw on the floor. We should never apply wet bandage as it will shrink and become too tight on drying.